this video is to discuss the different layers of skin and how burns and wounds might be classified. So the first thing that we are going to do is we're going to talk about the different layers of the skin. There are three layers that we'll primarily be discussing, and the first is the epidermis, which is the most superficial layer of the skin. The second layer is the dermis, and the dermis is a little bit thicker than the epidermis. The dermis contains most of our nerve bundle fibers, our hair follicles, a lot of vasculature is found in the dermis. And then we have our hypodermis, which is the bottom layer, and below this would be any type of subcutaneous tissue. When we look at burns and wounds, we're going to see that they're very similar in their classification. So we'll start with burns first. The most superficial type of burn is a first-degree burn. So you can see that over here is our superficial burn. And a first-degree burn affects only the top portion of the epidermis. So a sunburn would be an excellent example of a superficial burn. The second type of burn that we'll see is a partial thickness, you might hear it called, and it's a second-degree burn. This burns the layer all through the epidermis and starts burning the dermis. These tend to be pretty painful. So we see that when you burn through the epidermis, you'll get a nice bright red blister on it, and you might have some water in that blister or some serous fluid inside that blister. So really bad sunburn or touching something that is far too hot could give you a second-degree burn. Our third-degree burn burns through the epidermis and through most of the dermis. Now these ones are a little bit different because once you burn through all of the dermis, you've killed off all the blood supply and you've killed off the nerves that are innervating the dermis. So our third-degree burns tend to be white because they don't have any blood supply any longer, and they tend to be painless. That is not painful because all the nerves have been burned off, so there's no sensation going to the skin that is still left over. Our final burn is a full thickness burn, and this burns through all the layers of the skin and into the subcutaneous tissue. Now these are painful again because we've gotten deep into our body at this point in time. We'll see that the patient will look charred, and they might have what's called eschar, which is a blackened, charred type of skin or scar tissue over where the skin once was. Rehab frequently for our burns, you'll see, is focused on positioning and range of motion, as well as ambulation if possible, and scar management as we try and heal the burn. Wounds, on the other hand, are slightly different. We'll see that they're staged 1 through 4 based on, again, what is been affected. Our stage 1 wounds are going to be redness. The skin is still intact. You might hear the term non-blanchable erythema. So the skin turns red, and when you press on red skin and you lift your finger, it turns white, and then it refills or capillary refills with redness again. A non-blanchable erythema means that if it's red and you press on the skin, it doesn't turn white. It stays red-colored. Our stage 2 is a blister. So once it becomes a blister, it is definitely stage 2. Our stage 3 is now through the dermis and the epidermis, and we have an open wound now. So we're down in this depth of area here. As we progress towards a stage 3 wound, we're going to see that these are much more difficult to heal and are probably going to require some sort of wound care intervention. Early stages, a stage 1 and a stage 2, can usually be cured with just a little bit more prevention, perhaps getting a specialized seating arrangement for the patient, or a turning schedule if they are bedbound, or just watching that the skin doesn't break down, watching for excess pressure. Our stage 3 is going to need a lot more work and a lot more dressing. There's definitely a higher risk of infection with a stage 3, and once we get into a stage 4, which is subcutaneous again, so below the skin level, we have a very high risk of infection. In fact, if the bone is visible, or if you can see the bone from the outside, that means that the bone probably has an infection in it, and it's called osteomyelitis, which is an infection of the bone. Rehab primarily for wounds is going to work on positioning the patient, but also on any type of wound care, including a wound vac, which you'll see in the lecture.